Ticagrelor versus aspirin in acute stroke or transient ischemic attack. Ticagrelor is used for the prevention of thrombotic events in people with acute coronary syndrome or myocardial infarction with ST elevation. The drug is combined with acetylsalicylic acid unless the latter is contraindicated. The FDA indication for Ticagrelor is reduction of the rate of cardiovascular death, myocardial infarction, and stroke in people with acute coronary syndrome or history of myocardial infarction.
Primary prevention of stroke requires the management of atherosclerotic risk factors, such as hypertension, diabetes, smoking, and dyslipidemia. As the risk increases, secondary stroke prevention factors include identifying whether or not the patient has suffered from prior transient ischemic attack, stroke, coronary artery disease, peripheral vascular disease, asymptomatic carotid stenosis, or atrial fibrillation. All patients with ischemic stroke or transient ischemic attack should be on antiplatelet therapy or ASA for secondary prevention of recurrent stroke unless there is an indication for anticoagulation or a contraindication to ASA. Anticoagulation long-term with warfarin is the superior antithrombotic if atrial fibrillation or other definite cardiac source of embolism is identified as the cause of stroke or TIA. Surgical intervention is very effective in the prevention of stroke in symptomatic severe internal carotid artery stenosis. Earlier intervention yields greatest benefit.
Aspirin, also known as acetylsalicylic acid, is a medication often used to treat pain, fever, and inflammation. It is also used long-term at low doses to help prevent heart attacks, strokes, and blood clot formation in people at high risk of developing blood clots. Low doses of aspirin may be given immediately after a heart attack to prevent clotting and reduce the risk of another heart attack or the death of heart tissue. Aspirin may be effective at preventing certain types of cancer, particularly colorectal cancer.
Nobody wants a heart attack or a stroke, and if we have thicker blood, we tend to increase our risk of getting a heart attack or a stroke. And on TV all the time we're seeing ads for taking Plavix and aspirin to prevent a heart attack.
And now Pradaxa, all the new ones that are out. It's amazing the direct-to-consumer ads when it comes to this whole subject.
And one of the things that just came out that's really serious is when doctors combine them and have you take like Plavix along with an aspirin or Coumadin along with an aspirin because it can make you hemorrhage.
And that we know all that, but the problem is the doctors are trying to do the best job they can to prevent that stroke. And the stroke is a big deal. You get a stroke and you're paralyzed and you can't talk and you may not get a full recovery from it. You may not be able to see right or walk right or have balance.
But
That's a big deal.
But you can also have a hemorrhagic stroke.
Indeed.
So you can go from one extreme to the other, either from a clot that's blocking off those blood vessels, or you can hemorrhage and block them off.
Well, 85 to 90% of strokes are clots. The other 5 or 10% are bleeds. Bleeds are definitely more difficult. And if you're on a drug while you're one of these anticoagulants, when you have a bleed, it's lights out.
And we already know with aspirin, you just can take one baby aspirin and they do an endoscopy and it shows that you're already bleeding from just that.
Well, if you take it for a period of time, there was a study done in the New England Journal of Medicine on people who had 81 milligrams a day, which is a dose for a baby aspirin, and they were taking it to protect them from having heart attacks. And a year later, they went in and looked at them with endoscopy, and when they looked, 28% had a 3 millimeter, size ulcer or bigger, and the rest of them were bleeding most of the time. So even aspirin is something that by itself is a major issue. And that's why it's not really recommended for people who have never had a heart attack before, even though most doctors are still recommending it because of the fear of getting a heart attack.
Aspirin, a dose of 50 to 3005 daily is commonly used. The benefit of aspirin in the secondary prevention of ischemic stroke is limited. Even with current aspirin treatment, the rate of a recurrent stroke is 10 to 15 in the first 90 days. Ischemic stroke and transient ischemic attack are common, and the risk of subsequent ischemic events is particularly high during the first 90 days after the index cerebrovascular event.
Today is World Voice Day. It's a day designated to get us thinking about something that so many take for granted, the ability to speak. Local 10's medical specialist Christy Kruger is here now with the details.
Something we don't take for granted in our business for sure, but there are some key do's and don'ts when it comes to protecting that voice of yours. Drinking lots of water can help protect your voice, while drinking too much coffee, too much tea, too much soda, I'm guilty of that one, can have some damaging effects. Experts say the key is paying attention to your voice and recognizing when you're starting to have a problem.
A voice problem that's come on kind of gradually and gradually gotten worse, and no precipitating episode. You didn't have a cold or flu or virus or something like that.
So also in today's HealthCast, a look at the very latest research regarding key medications for heart disease and stroke. Our cardiologist, Dr. Ari Silver, has more in his Second Opinion report.
An aspirin a day keeps the cardiologist at bay. For years, that mantra has been considered a key factor in reducing the risk of heart attack and stroke. While it appears to hold true for people who've already experienced either condition, Dr. Gervasio Lamas says that's where aspirin benefits stops.
It really shows that science evolves.
The Food and Drug Administration says people should not be taking aspirin to prevent a first heart attack because the risks are greater than the benefits.
What's a side effect of aspirin? Gastrointestinal bleeding and hemorrhage in your head.
There's also confusion about who should be taking statins. More than cholesterol numbers, Dr. Lamas says the key is a calcium score, which better shows the health of your heart.
What happens is that when fat gets into the arteries, the way the body responds to it, sort of as a healing process, is it lays down these little flecks of calcium.
When her cholesterol levels came back high, Jackie Mastrangelo followed doctor's orders to take a statin. But when her calcium score came back low, she welcomed the recommendation to stop the medication.
Patient had an acute ischemic stroke with a National Institutes of Health stroke scale score of 5 or lower, or high risk transient ischemic attack, and could undergo randomization within 24 hours after symptom onset, were at least 40 years of age, and had undergone a computed tomographic scan before randomization to rule out intracranial bleeding or other condition that could account for the neurologic symptoms. Patients were not eligible for participation if other specific antiplatelet therapy was planned or if carotid cerebrovascular was planned that would require halting study treatment within 7 days after randomization. Patients were also not eligible if they had hypersensitivity to Ticagrelor or aspirin, had a history of atrial fibrillation, ventricular aneurysm, cause for transient ischemic attack or stroke, or an intraarterial thrombolysis within 24 hours before randomization. Required treatment with non-steroidal anti-inflammatory drugs for more than 7 consecutive days.
So I'm presenting here is a subgroup analysis of the Plato study. So just to give you a background, the Plato study tested the hypothesis that a more potent P2Y12 receptor inhibitor, Ticagrelor, was more effective than clopidogrel in reducing the composite of death, MI, and stroke in patients with acute coronary syndromes, a broad patient population. And in that study, prior intercerebral bleeding was a contraindication for the study, but patients with prior stroke or TIA were accepted in the study. And that is a very important patient population because it's a patient of high risk of ischemic events and bleeding events. And this population is fairly large. It's more than 1,000 patients. They have clearly a higher risk of all events that we recorded, mortality, primary composite, all ischemic events and bleeding events, of course, as you would expect. But interestingly, when we look at the randomized treatments, Ticagrelor versus clopidogrel, they were very favorable.
A mini stroke is a common expression that people use for what is more formally called a transient ischemic attack. A transient ischemic attack refers to the fact that it is temporary, it's transient, by definition lasts less than 24 hours, ischemic in that the presentation is based on decreasing blood supply to the brain. That's why you're having that event. And the attack is the description of the event, like the loss of speech, loss of vision, loss of strength, loss of sensation. People are often not sure what's happening to them. They lose vision. A gray area comes over their eye temporarily, or they can't speak for a matter of minutes or an hour, or they become weak or numb in one side of their body. Those are common presentations for so-called.
In our trial involving patients with acute ischemic stroke or transient ischemic attack, Ticagrelor was not found to be superior to aspirin in reducing the risk of the composite end point of stroke, myocardial infarction, or death.
Taking view from patients in the hospital, medical first, and patient in the stroke center is the largest incidence of process, especially on several estimated days. So we are taking the leading position in China for the clinical practice and the clinical research. Today, I'm going to give you the presentation of the result of the large RCT transfer and one of the subgroup analysis of acute stenosis. So everybody knows that the OT treatment and intervention and risk factor is significant. So the result from the subgroup analysis indicates the combination of the clopidogrel and aspirin treatment with a chance to better reduction of the current stroke at 90 days. So there is still not significant difference. The greater bias might be for sample size. On the other hand, if you look at the direction of the two treatment or those with ICAS, there's no significant difference as well.
Good evening and welcome to 60 Minutes. Every 10 minutes in Australia, somebody suffers a stroke. It's our second biggest killer and has left nearly 500,000 survivors. She suffered a stroke 3 years ago, which left this teacher barely able to walk or talk.
4, 5.
Doctors have told her this is how she'll be forever.
That's why Linda's travelled